What causes numbness in the legs? If you have numbness in your legs, you may be concerned about what's causing it, how long it's going to last, and if it's reversible. And it's very natural when you have something like numbness that you know is really not normal to be concerned about it. And naturally, our mind just jumps to the worst case scenario. That, hey, if I can find out the worst that I'm dealing with, then anything less than that is going to be okay. Well, the good news is that most causes of numbness in the legs are not serious and are completely reversible. But I'm going to give you kind of the whole gamut, the good, the bad, and the ugly, and then give you some solutions for some of the most common causes of numbness in the legs. Now, if you're new to the channel, I'm Dr. Dave Candy, and at More for Life, we help people to stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. Now, if you find this video helpful, give it a like and leave a friendly comment letting me know what you find helpful. And don't forget to hit the subscribe button so you can get notified of our future videos. So let's start with what causes numbness in the legs. There are generally three different categories of things that can cause numbness in the legs. There are primary nervous system disorders, for example, like a stroke or multiple sclerosis or a spinal cord injury, a problem where there's actually an injury or damage to the nervous system itself. And sometimes those are reversible, but oftentimes in the case of like multiple sclerosis or a spinal cord injury, there may be some lasting extent. Now, the good news is that's fairly rare in comparison to how many people have numbness in their legs. That's only a very small percentage, and usually if you have one of those things, it's most likely that you already know it. If you're watching a YouTube video to try to figure out the causes of numbness in your legs, then chances are fairly decent that it may not be one of those really severe, irreversible problems. And again, those are primary problems with the nervous system. Now, the second cause of numbness in the legs are metabolic disorders, things where there's a problem in some other system in your body and it's making the nerves unhealthy. Examples of this might be diabetic neuropathy, where your blood sugar gets too high and it impairs the circulation and nutrition of your nerves. It may be a vitamin deficiency, or if you have alcoholism, damage to the liver can cause numbness in your legs, or peripheral artery disease. If you're not getting sufficient blood flow to the nerves in your legs, that can cause them not to function properly. Now, the third and least severe category, but the most common one, is just nerve compression. And that nerve compression can come from various places. It can come from your lower back, which is probably the most common. It can come from peripheral nerve compression, which that depends on the specific nerve. And we'll delve into that here in just a little bit. Now, you can also get compression of your spinal cord in your neck, which can cause numbness in your legs as well as in your hands. And just know that that's a thing. I do have another video about spinal stenosis in the neck, and I'll refer you to that video for more information on that problem. But in this video, I'm going to cover the different causes of nerve compression in the lower back and below. So the nerve roots that come out of your lower back, as well as the peripheral nerves that go down into your legs. Now, a back problem is the most common cause of numbness in the legs. And if someone walked into my office and said, I have numbness in my legs, I'd pretty much start to think it's a back problem until I can rule that out. So what are the things that can cause numbness in your legs that come from the lower back? Well, the nerve roots from your lower back, they come out through the L1, L2, L3, L4, L5, and S1 nerves. Now, the upper nerves, particularly L2, L3, and L4, make up the femoral nerve, which runs down the front of your legs. And the femoral nerve then has a branch which goes down into the inner lower leg here. Now, you can also get a compression of that femoral nerve somewhere along the course of the nerve, so below your lower back, where it comes out in your inguinal canal right here. That can happen if you have, say, stiff hip flexors. That can put pressure on your femoral nerve. Or if you have stiffness in your quadriceps, that can put pressure on your femoral nerve as well. And so it is important to distinguish between a spinal compression of the femoral nerve or a peripheral compression. Now you can do that largely based off of movement tests, that if either bending forwards or bending backwards affects the numbness in your legs, either makes it any better or makes it any worse, that's a decent indication that the problem may be coming from your back, those L2, L3, L4 nerve roots. If moving your back doesn't affect it, then you'd want to go check the peripheral nerves in the area that go down into your femoral nerve. And so one way to check that is to check the flexibility of your hip flexors. And to do that, you'd lay down on a bed or some other surface and let the affected leg fall down while pulling this leg up. Now, normal would be for your leg to fall all the way down to the bed and your knee to bend to 90 degrees. Now, mine are a little stiffer than ideal. You can see there's a little gap right here. Ideally, that would be all the way flat, but I have to arch my back in order to do that. Now, just because you have stiffness in your quadriceps or your hip flexors, it doesn't necessarily mean that it's a peripheral compression, because when your hip flexors are tight, they pull you into a forward pelvic tilt, which puts more arch in your lower back, and that can actually compress the spinal nerve roots as well. So it is important to distinguish whether it's coming from the back or whether it's coming from the leg. And if you're not certain about that, reaching out to a physical therapist is a good idea, particularly one who deals with a lot of different spinal conditions. And if you are in the St. Louis area, we'd certainly be happy to help you with that at More for Life. But now let's move on to probably the more common problem, which is sciatica. That's numbness in the back of your leg. That may or may not be associated with pain or other symptoms, but if you have numbness in the back of your leg, either in the thigh or going down into your lower leg or foot, that's usually caused by some sort of compression of your sciatic nerve or the nerve roots that make it up. And the nerve roots that make up your sciatic nerve are the L4, L5, S1, and S2 nerves. And so we'll go through first how to tell whether it's coming from the nerve roots in your lower back or if it's coming from a peripheral compression somewhere else in your leg or in your hip, and then some different ideas for what you can do to help if you have a sciatic nerve problem. So first, how do you tell if it's coming from your lower back? Well, similarly to the L1, L2, L3 nerve roots, if different positions affect it. For example, if you have it more often when you're standing and walking than when you're sitting, that may be one indication that it's coming from the back. When you're standing up, your spine's relatively more extended. When you're sitting down, your spine is relatively more rounded out and relaxed. And so when you stand up and you arch your back when you're standing, that narrows the spaces where the nerve roots in your lower back, particularly those L4, L5, and L5, S1 segments, they tend to get the most extension, and that extended position can narrow the space where those nerve roots come out and go down and form the sciatic nerve. Now, again, probably the back problem is the most common cause of sciatica. So I'd start there and make sure you can rule that out first before checking down into further areas. But the next place that your sciatic nerve goes is through your pelvis. And one really common thing that people talk about when they talk about sciatic nerve problems is piriformis syndrome. And a true compression of your sciatic nerve at your hip is not extremely common in regards to the total number of cases of sciatica, but it does happen. There's a small percentage of people who have their sciatic nerve actually run through the piriformis muscle, and they're probably the people that are at most likely risk for developing a true piriformis syndrome or compression of the sciatic nerve at the hip. Now, if you do have a compression at your hip, you may notice that sitting on different surfaces. For example, sitting on a soft surface may not be quite so uncomfortable, but if you're on a really, really hard surface, that may irritate your sciatic nerve in your buttock. Now, conversely, for people who have a back problem, sometimes having a hard, firm surface where their back gets better supported because the surface is firmer is actually a little bit better versus a soft surface may be worse for certain types of back problems. And so even though there's less pressure on your butt, it would cause your spine to kind of sink down in a little bit more and irritate the nerve roots at the lower back. But if direct pressure on your buttocks, for example, sitting on a hard chair, does increase the numbness in your leg, then that's one indication that maybe there is a peripheral problem going on in your hip. Now, if you do have that peripheral problem in your hip, you also have to decide whether it's because the piriformis is too stiff or whether because it's been chronically overstretched and lengthened, and that's what irritated the sciatic nerve. And that's really important to distinguish because the treatments are opposite. If the muscle is too short, then you want to lengthen or stretch it. But if it's already overstretched and that's the reason that it's causing the numbness in your leg, then further stretching your piriformis, which is a really common treatment for sciatic nerve problems or piriformis syndrome, actually can make the problem a little bit worse. So how do you tell if you actually need to stretch your piriformis? Well, there are a couple different ways that you can stretch your piriformis. One of them is crossing your leg over like that and then pushing down that way. And the other way is pulling up and across your body sort of towards the opposite shoulder. Now, if you compare one side to the other, particularly if you have only numbness in one leg, and you notice, okay, this one moves a little bit less, and this one moves a little bit more. Well, if I'm having a problem in this side, then perhaps it's because that piriformis is too stiff and short. Conversely, if the problem is in the side that's more flexible, then it's likely that the problem is from an overstretched and overlengthened piriformis, in which case you probably want to do things to help strengthen your hip muscles rather than further stretching that already overstretched muscle. Now, moving down from there, you can actually get compression of the sciatic nerves in your hamstrings if your hamstrings are really stiff. Your sciatic nerve runs down through the back of the hamstrings before going into the knee, and then it splits down into two branches in your lower leg. Now, you can check your hamstring flexibility by laying on your back, bringing your hip up to 90 degrees, and then straightening the leg. And if you can get almost to a straight up angle, or at least pretty close to there, then your hamstring flexibility actually isn't that bad. And almost everybody thinks that they have stiff hamstrings. Even gymnasts who can put their leg way over their head, they complain that their hamstrings feel stiff or tight. But if you can get to a 90-degree angle or within 10 degrees of that, your hamstring flexibility is actually in a normal range. And overstretching your sciatic nerve can give you a feeling of stiffness or tightness, but nerves aren't made to stretch. So if you keep further overstretching your hamstring, then that's going to further irritate the problem. So one way that you can help if you have a hamstring problem is to do sciatic nerve glides, where you just kind of go in the range that feels comfortable without getting symptoms. And if you start getting symptoms, say at this level of straightening, move to a different angle. If you start getting symptoms at that level of straightening, you don't want to go farther, even if you can. Now, another thing that can be helpful if you do have a sciatic nerve problem that's irritated by stretching your hamstrings is using a rolling pin or massage stick on the back of the hamstrings and just kind of rolling around like that, rolling gently. You don't want to further mash down on that irritated sciatic nerve, which is one reason why I'm not a huge fan of using a foam roller if you have a sciatic nerve problem, because when you're putting your full body weight down, you're really probably compressing the sciatic nerve more. Whereas with something like a stick or a rolling pin, you can control the pressure and just go down more superficially where you're just massaging the muscle and you're not getting deep enough to really irritate that sciatic nerve. So moving down from there, after your sciatic nerve goes down to your knee, it then enters into your lower leg, and it branches into two different branches right above your knee. There's one branch, the common fibular nerve, which runs down the outer side of your leg here. And then there's another branch, the tibial nerve, which runs right down the back of your leg and goes down kind of by your Achilles tendon. So if you have numbness that goes down into your lower leg, it is important to distinguish which branch that is, particularly if it kind of skips the thigh region. Because if you have numbness that goes all the way down, it's more likely that it's either being pinched or compressed at the nerve root level in your lower back or somewhere in your hip. If you have numbness in your lower leg and in your foot that skips your thigh, chances are pretty good that there's something going on down in your lower leg as well, even if there may still be something going on in your back or in your buttock. So what do you do if you have a lower leg problem? Well, I've got another video that I'll link out to that explains some different things you can do if you have numbness and tingling in the outer side of the leg and the top of your foot. But just to give you a very brief rundown of that video, one thing you can do is kind of cross your leg over like this, kind of like you're doing the piriformis stretch, and then just do a little bit of a push and pull here, which realigns the tibia and the femur. So the tibia is your lower leg bone, and the femur is your upper leg bone. Additionally, there's a little joint right behind your knee, right here, where the fibula, your smaller lower leg bone, joins with your tibia, your bigger lower leg bone. And doing a stretch for that joint can actually help to move that fibula forward so it's not compressing that common fibular nerve, or common peroneal nerve is another word for it. So the way that you do that is put your foot up on something like this. Then you take your hand and you find that bump right on the outer side of your knee. Now, you don't want to get really pokey back there. It helps to take a good portion of your hand, kind of cup it with the meat of your hand there, and put the pressure right behind that fibular head or the bump on the outside of your knee. Then lean forwards like this and put pressure with your hand into the back of that fibular head, and then come back, go forward, and go back, and go forward, and go back. Now, if you start having increased numbness in your leg when you're doing that, stop altogether or reposition your hand so that you're not further compressing that fibular nerve. But if that fibular nerve is being irritated behind that tibiofibular joint, doing that little mobilization can be something helpful to help free that up. Now, what if you have a tibial nerve problem, a problem in that nerve that runs down through the back of your calves? Well, in many cases, stretching your calves can be helpful for that type of problem. And a lot of people actually do have stiff calves when they have sciatica or some other type of problem affecting the back of their leg. So stretching your calves is really important. The scope of how to do that, I'll link to another video here showing how to do a calf stretch properly. And many people do it wrong. So I would take the time to go and look at that, because I'd say 90–95% of people that I see in my office don't do their calf stretches properly. But another thing is just using that massage stick again. So just like you were using it on your hamstrings before, kind of taking it and running it down the outer side of the calves and the back of the calves and the inner side of the calves. You have two different heads of your gastrocnemius calf muscle, which is the long one that crosses your leg, as well as a deeper head called your soleus. And so it is important to move around and find those different areas. Often that inner side of the gastroc, or the medial gastrocnemius, is stiff in most people. So I would move around with the stick and try to find some different areas. And then after you've gotten all of those areas decompressed or loosened up, by rolling your hamstrings, rolling your calves, doing that nerve glide again where you kind of straighten out like that and just go back and forth is a good way to help get the nerves moving. Because just like with peripheral vascular disease or diabetes, your nerves need good blood flow to be healthy. And so you want to first free up the space by stretching, massaging, doing whatever else you need to do to decompress those nerves. Then getting movement and blood flow through doing either sciatic nerve glides or aerobic exercise is good for just about all causes of numbness in your leg, whether it is arterial disease or diabetes. That helps increase circulation. It helps keep your blood sugar down. And it also helps increase circulation if you do have more of a peripheral nerve compression. If you do have a spinal problem or a problem with your discs, when you walk, that upwards and downwards compression of your spine, it helps circulate nutrition to the disc to help them heal up. And so walking is a great exercise if you do have some numbness in your legs, pretty much regardless of the causes. So hopefully you found this video helpful. I know it may have been a little bit overwhelming. That's the beauty of videos, that you can always go back and rewind and watch again. But if you do need some further clarification and you happen to be in the St. Louis area, we'd be happy to help you out here at More for Life. Just contact us at our office. And again, if you're watching this from somewhere else, but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.